welcome to the deep dive. Okay, think about this for a second.
Mm-hmm.
There are literally hundreds, maybe even, I don't know, thousands of books in China, old and new,
Yeah.
all trying to map out every single way the body can go, out of balance
It's incredible, isn't it? The depth of it.
and how to get it back.
Yeah.
It's kind of mind-blowing. Okay, so let's try and unpack some of this vast world of traditional Chinese medicine today.
It is, yeah, it's a deep well. And look, today we're kind of offering you a bit of a shortcut,
Oh,
maybe.
shortcut, I like that.
Yeah, into understanding a slice of it anyway. We're going to explore how TCM looks at some, familiar Western diseases stuff you've probably heard of.
Right?
And the really unique patterns and treatment strategies it uses, we're basing this on a clinical manual that's specifically designed to bridge these two medical worlds.
Exactly. And it's important to say this manual isn't like a cookbook, right?
No, definitely not.
You don't just look up headache and find the answer. It really hammers home that in TCM, every single person is different.
Mm-hmm. Individualization is key.
So the best treatment is always, always tailored.
Yeah.
And it also points out that, while we often think of Chinese herbs and acupuncture together,
Yeah, they often are used together.
they're actually distinct fields. Each has its own really complex understanding of the body.
Right.
But here's where it gets really interesting.
Okay.
This idea of pattern discrimination.
Ah, yes, that's fundamental. What's truly fascinating is getting your head around that basic logic. It's not just about sticking a label on a disease.
Right.
It's about figuring out the specific underlying imbalance in you, the listener, the patient, that's causing your specific symptoms.
So the disease name is one thing, but the pattern,
Yeah,
that's like the unique story of how it's playing out in your body.
exactly. Well put. And then the treatment principles, they act like the bridge,
Hmm?
They guide us from that unique story, that pattern, to the right therapy.
Okay, so instead of just, you have a cough, take this pill, TCM goes way deeper. It asks, why is this specific cough happening in this body right now? Is it dry? Is it phlegmy? Is it happen only at night? That kind of thing.
Spot on. And the manual is really clear that these treatment principles, they need to be stated using standard TCM terminology. It's a specific language.
Like the example they give. If the pattern is liver spleen disharmony,
Mm-hmm.
the treatment principle isn't just fix the liver and spleen, it's harmonize the liver and spleen. It's specific.
Exactly. It reflects a precise understanding of the imbalance and the therapeutic aim. And, sometimes the Western disease name itself can actually give us some initial clues about potential TCM patterns.
Oh, really? How so?
Well, take the term Zabing. It translates roughly as miscellaneous diseases.
Okay, sounds a bit vague.
It does, but within TCM, it's actually a category that groups together both common symptoms like headaches or dizziness, but also some unique Chinese medical concepts.
Like what?
Things like mounting, which can cover hernias and similar issues, or wasting and thirsting, which relates to conditions like diabetes,
Well,
and strangury for urinary problems. And each of these Zobbing categories, they come with centuries of knowledge about the likely patterns and treatments involved.
wow. So even a seemingly broad term in TCM can unlock all this specific, nuanced understanding.
That's the idea. It's a starting point for a much deeper look.
That's amazing. Okay, let's dive into some actual examples. Western diseases and the TCM view. How about we start with something I think a lot of people deal with? Liver depression, Qi stagnation.
Yes, liver qi stagnation. It's incredibly common in TCM terms. Think of your body's energy, the Qi, like a river, right?
Okay.
In this pattern, the smooth flow, especially the flow managed by the liver system, gets blocked up or just sluggish. Stuck, yeah. And the manual really emphasizes it's usually not just one single cause.
Right, life happens.
Exactly. It can be triggered by all sorts of modern stressors, thinking too much, anxiety, worry.
Check.
Not enough exercise, poor diet, even side effects from medications can contribute.
It really sounds like TCM's way of describing how chronic stress just messes with our systems.
That's a big part of it. And the manual notes, it rarely shows up all by itself in a simple form. It often complicates other chronic health problems.
They get tangled up.
It does. Because so many things can feed into it, it often intertwines with other imbalances. The manual also mentions specific Chinese medicinals, herbs, that are often used to help get that energy flowing smoothly again through what TCM calls the network vessels.
Network vessels. Like tiny pathways.
I like the microcirculation, yeah. Tiny channels throughout the whole body.
Interesting. Okay, what about another one? Spleen Qi vacuity. That sounds like it could be related to maybe Low energy or digestive issues?
Spot on. Spleen Qi vacuity basically means the spleen system's energy, its Qi, and its ability to function properly are weakened.
Okay.
And the manual explains that if the spleen Qi isn't strong, well, it can lead to a whole bunch of problems. One key job of the spleen is to upbear the clear yang.
Upbear the clear yang. What does that mean?
Think of clear yang as the vital, light, uplifting energy. It's supposed to rise up, nourish your head, keep you clear-headed, focused, energetic.
Got it.
If the spleen Qi is weak, it can't lift this clear energy properly. Instead, that vital energy can kind of sink downwards, become stagnant, and even transform into what TCM calls depressive heat.
Depressive heat. So the stuck energy doesn't just sit there, it actually changes and causes more problems.
Exactly. It can ferment, basically, and generate this low-grade heat. And the manual mentions this can even stir up something called ministerial fire.
Ministerial fire. That sounds intense.
It can be. And this rising heat can then, in turn, further weaken the spleen Qi. It can create a vicious cycle. And over time, it can start affecting other organ systems, the liver, stomach, lungs, heart, kidneys. The manual also points out this negative heat can disturb the heart spirit.
Heart spirit that relates to emotions and mind.
Yeah, our emotional well-being, mental clarity. So it could contribute to things like anxiety, maybe brain fog, trouble focusing. It really shows how everything's connected in TCM.
These knock-on effects are really fascinating. Okay, let's shift to some concepts that sound, well, a bit more unusual from a Western perspective. These gutworms and chongworms mentioned in the manual sounds almost mythical.
Hey, yeah, they do sound a bit strange to our ears, but they're unique TCM concepts for disease-causing factors. Historically, it was understood as a kind of deep-acting toxin or like an insidious influence.
Like a parasite, but maybe not literally?
Sort of. Something that could spread internally and cause really complex, chronic problems with lots of seemingly unrelated symptoms. The manual points out gut conditions often involve digestion, muscle and joint pain, psychiatric or neurological issues, skin problems.
A real mixed bag.
Totally. They were thought to deeply damage the body's core energy, especially the spleen and kidney Qi.
So like an invisible saboteur causing chaos everywhere. And what about chongworms? The manual actually says modern TCM classifies Candida albicans as a type of chong.
That's right. Chong is maybe a slightly broader category. Traditionally, it included things like intestinal parasites, sure, but it also covers these kinds of, well, invisible pathogenic organisms that can cause issues, maybe skin diseases, internal
So
problems.
TCM adapts. It sees something like Candida overgrowth and fits it into its existing framework.
Exactly. It shows TCM isn't static. It's a living system that can incorporate new understandings, like identifying Candida, within its own diagnostic language.
Okay, fascinating.
Hmm.
Let's move to something more familiar maybe, but with a TCM twist. Blood stasis. We usually think of, a bruise or a clot after an injury.
Right, and trauma is definitely one cause in TCM too, but the manual highlights several other really key factors.
Yes.
Well, Qi vacuity is a big one. If your body's energy, your Q, is weak, it doesn't have the oomph to push the blood through the vessels properly, so it stagnates.
Okay, like a weak pump.
Sort of, yeah. Then there's blood vacuity itself. If the blood is deficient, maybe thin or just not enough, it doesn't nourish the vessels well, and it can become sluggish too.
So lack of energy or lack of blood can both lead to stasis.
Correct. And then there's the effect of cold. This could be internal cold, like a deficiency of your body's warming energy, your yang Qi. Or it could be external cold, literally invading the body. Cold constricts, right? So it physically impedes blood flow.
That makes total sense. Cold makes things contract. Okay, and the manual talks about a reflexive relationship between fresh blood and static blood. Can you break that down?
Sure. Think of it like a cycle. If you don't have enough healthy flowing blood, that's blood vacuity, it makes it easier for the blood. You do have to become stagnant.
Okay.
But then once you have static blood just sitting there gumming things up, it actually hinders the body's ability to generate fresh, new, healthy blood. So one problem feeds the other. It's a loop.
A vicious cycle again.
Often, yeah. And the manual also points out the close link between blood stasis and phlegm accumulation. They often show up together and can make each other worse.
Right, and there was that interesting quote from Zuliang Chun about treating phlegm by quickening the blood. That's not an obvious connection.
It's not, is it? But it really underlines this core TCM idea that different substances and processes in the body are deeply interconnected. You can influence one by working on another.
Which brings us to phlegm itself. It's clearly not just the stuff you cough up when you have a cold, right?
Oh, absolutely not. In TCM, phlegm is a much broader concept. The manual explains it can be both a cause of disease and a result of disease processes.
Okay.
And there's this really important idea of hidden phlegm or deep-lying phlegm. It might not be obvious.
How would that show up then?
Well, the manual uses allergic rhinitis and asthma as examples. Someone might have this underlying hidden phlegm, maybe related to weak digestion or diet.
Mm-hmm.
And then when something else comes along, like exposure to wind or pollen or dust mites, it disrupts the lung function and poof, the phlegm becomes manifest. You get the runny nose, the wheezing.
Ah, so it was lurking there and then something triggered it to show itself.
Exactly. So even if someone isn't actively coughing up stuff, phlegm can still be gumming up the works internally, contributing to imbalances.
Okay, that's a really important distinction. Now, let's shift gears slightly. Body types. The manual mentions 4 yin-yang body types briefly.
Yeah, it touches on them. Tai Yang, Xiao Yang, Tai Yin, and Xiao Yin. It's like TCM recognizing we're not all built exactly the same, you know?
We have different tendencies.
Exactly. And it focuses a bit on the Xiao Yin type, describes them as often being more slender, maybe tending towards yin deficiency, and also liver depression.
Okay, so a certain constitution might predispose you to certain patterns.
That's the idea. The manual notes that Xiao Yin types often don't carry a lot of muscle mass, and they can develop deficiency heat more easily, that internal heat that comes from a lack of cooling fluids, or yin.
Right.
And they're also more prone to liver depression because, well, there isn't enough nourishing blood and yin fluid to keep the liver system happy and flowing smoothly.
So what does that mean for them, lifestyle-wise?
The recommendations for this type often emphasize getting enough rest, avoiding things that can deplete yin further, like too many stimulants, spicy or drying foods, and actually including things like bloody meaty foods, as the manual puts it, to help replenish their substance, their essence. It's a really interesting link between our basic constitution and how we should live to stay balanced.
It really is. Now, pulling back to the bigger picture, especially with Western patients dealing with chronic stuff, the manual makes a huge point. It's almost never just one simple TCM pattern.
That's so crucial to understand. Yes, chronic Western diseases. They usually involve multiple TCM patterns all happening at once. The manual suggests anywhere from like 3 to 8 patterns, maybe even more.
3 to 8, wow.
Yeah. And here's the really key part. When these different disease mechanisms interact inside the body, they can actually change the way each individual pattern shows up. The classic signs and symptoms can get altered.
So the textbook picture of pattern A might look different because pattern B and pattern C are also going on.
Exactly. The example they give is great. Spleen Qi vacuity combined with stomach heat.
Oh.
Normally, spleen Qi vacuity might give you a poor appetite, but if you also have stomach heat, which tends to increase appetite, well, your appetite might seem normal or even ravenous.
Ah, so the heat is masking the deficiency symptom in a way.
Precisely. So it makes diagnosis tricky. You can't just tick boxes.
So how do TCM practitioners navigate that complexity? How do they figure out the main issues?
The manual stresses looking for the key symptoms. These are the most reliable, the most consistent signs that really point towards the core underlying patterns, even when everything else seems messy and confusing.
Got it. Finding the signal in the noise.
That's a good way to put it.
Okay, this all sounds incredibly detailed. Let's try to make it really concrete with that case study from the manual. The 45-year-old woman with fibrocystic breasts. Can you walk us through the TCM analysis?
Absolutely. So the analysis starts with the general TCM principle. Breast issues in younger women often relate to the liver system. But in older women, or when it's more persistent, it might involve the chongmei. That's a really important energy channel linked to both the liver and the kidneys, crucial for reproductive health.
Right. And she's 45, so kind of in that transition zone.
Exactly. Now, the fact her symptoms get worse before her period, that points towards a mix. Probably some spleen Qi and kidney yang vacuity, which is common premenstrually around this age. But also, as she's approaching that natural decline in reproductive essence, what TCM calls teen yi, there's likely some liver blood and kidney and vacuity creeping in too.
Okay, so multiple deficiency patterns potentially interacting. What about her other symptoms? Night sweats, hot flashes.
Those strongly suggest that yang energy is rising up inappropriately. Now, why is it rising? It could be due to an underlying lack of cooling yin or blood, maybe there's some damp heat involved, or it could be liver depression generating heat that then flares up.
And the cold feet, low libido, back pain.
Textbook kidney yang vacuity signs right there. They really strengthen that part of the diagnosis.
It's like putting puzzle pieces together.
It really is. Her period's coming early. That also fits with spleen qi or kidney yang vacuity.
Yeah.
They're not properly holding things in place.
Okay. And the lumps themselves, the fibrocystic changes.
Seen as phlegm nodules in TCM, and they tend to get bigger and more sore premenstrually because that's when Qi stagnation, maybe some blood stasis too, is often worse.
Got it. And the runny nose.
Also points to phlegm, and that plum pit Qi sensation, feeling like something's stuck in the throat.
Yeah.
Classic sign of both phlegm and liver depression blocking the throat area. Finally, the fatigue and bloating after eating, strong indicators of spleen Qi vacuity.
Wow. Okay. So many connections. And then there was the tongue and pulse diagnosis, right, that added more layers.
Crucial layers, yeah. Her tongue was slightly pale red, but with a redder tip.
What does that tell you?
The pale red suggests maybe some underlying blood deficiency, while the red tip points to heat rising upwards, likely towards the heart system. The thin white coating, though, showed there wasn't any major significant heat accumulating overall.
Okay. And the pulse? It was described as wiry.
Wiry pulse is the classic sign of liver depression, like a taut guitar string. But it was also slightly rapid, which confirms there's some heat involved.
And they check both wrists, right?
Yes, TCM pulse diagnosis is very detailed, checking different positions on both wrists that correspond to different organs. Putting it all together, the pulse picture suggested a subtle stirring of yang energy,
Okay.
rising up because the underlying yin was deficient. It couldn't anchor the yang properly. The slippery quality confirmed the presence of phlegm and heat, and the fact it felt a bit floating and large showed that yang energy was indeed pushing outwards and upwards.
Incredible. It just paints such a detailed, interconnected picture of what's happening inside her body.
That's the goal of pattern discrimination. It really brings it all together.
Okay, so now we have the pattern. How is it actually treated? The manual makes a big deal about decoctions, boiling up the raw herbs. Why are they often the standard in China for complex stuff?
Yeah, it's a really important point. The manual notes that here in the West, TCM practitioners often end up being caregivers of last resort, right?
Mm-hmm. Yeah, people have tried everything else.
So we see folks with really challenging chronic conditions. In China, for those kinds of complex long-term illnesses, think autoimmune diseases like RA or lupus, active cancers, the professional standard usually involves prescribing these relatively large, complex herbal formulas.
Okay.
And they're typically given as bulk dispensed decoctions. You get a bag of herbs, you boil them up yourself.
Why that method specifically?
Two main reasons: dosage and customization. Decoctions allow for a much, much higher dose of the active herbal ingredients compared to pills or powders. And you can precisely tailor the formula, change it week by week even, based on how the patient's pattern is evolving. Pills are more fixed.
So those little bottles of patent pills we see everywhere, they're not really the main tool for serious conditions in China.
Generally not for the really complex chronic stuff, no. The manual is a striking comparison. Taking maybe 24 standard pills a day might equal only about 4 grams of raw herb material.
4 grams, that's tiny.
It is. Whereas a typical daily decoction might use anywhere from, say, 150 to 180 grams of raw herbs, sometimes more.
Wow, okay, that is a massive difference in dosage.
Huge. And that's why the manual strongly advises against thinking you can effectively manage conditions like rheumatoid arthritis or lupus or cancer with just patent medicines alone.
Right.
It really stresses that for those kinds of deep, complex health issues, you need customized formulas based on the individual's specific and often changing patterns.
That makes perfect sense. Individual patterns demand individual treatments, especially when they're complicated. What about other therapies? Acupuncture, moxibustion?
Yeah, absolutely. They're very often used alongside the herbs. The manual actually includes suggested acupuncture protocols that correspond to many of the patterns it discusses.
So it's an integrated approach.
Ideally, yes. And it also brings up some important safety points when combining TCM with Western medicine.
Like what?
For example, being aware that certain Chinese herbs that quicken the blood or improve circulation could potentially interact with Western anticoagulant drugs like warfarin. You need to be careful.
Good point.
And another crucial one, absolutely avoiding any herbs that might be toxic to the kidneys. Nephrotoxic herbs in patients who already have chronic renal failure. That's just basic safety.
Right. Careful, informed integration is key.
Absolutely.
Okay, before we wrap up, let's just quickly run through a few more specific disease examples from the manual, just to give people a broader taste of the TCM perspective. How about acne? Acne vulgaris.
Okay, acne. The manual links the red, inflamed pimples mostly to heat in the body,
Makes sense.
while the whiteheads, the pus, the deeper cysts, that points more towards dampness and phlegm accumulation. It talks about how hormonal shifts at puberty can stir up what's called life gate fire.
Life gate fire.
Yeah, related to the kidney system's deep energy. And this can combine with heat already lurking in the lungs, stomach, or liver. Plus, you can have liver depression causing stagnant heat or weak spleen function leading to more phlegm. Even underlying yin deficiency, letting yang flare up, it's often multifactorial.
Wow, okay, so even acne isn't simple in TCM. What about ankylosing spondylitis?
Yeah, that painful progressive spinal inflammation. The manual acknowledges the Western understanding of the inflammatory process leading to bone fusion. While it doesn't detail specific patterns there, that understanding sets the stage for how TCM would likely approach the underlying chronic inflammation and pain, probably involving patterns of damp heat, blood stasis, or kidney deficiency.
Okay, how about something that's super common? UTIs, cystitis.
Right. The manual introduces the damp heat pouring downward pattern. That's the classic TCM view for an acute UTI, painful urination, urgency, maybe burning, specific tongue and pulse signs.
Got it.
But it also mentions that if urinary issues flare up with stress, you might look at liver depression and maybe phlegm nodulation affecting the bladder. And for more chronic low-grade urinary frequency, maybe spleen kidney yang vacuity is involved.
Different patterns for different presentations. Asthma and emphysema.
The manual notes that emphysema, called Feizong in TCM, often shares similar underlying patterns with chronic asthma, especially if it's from long-term smoking.
Okay.
The three main patterns it highlights are lung qi depletion and vacuity, just weak lung energy, lung and kidney qi vacuity, a deeper deficiency involving the kidney's role in grasping air, and lung qi not securing, where the lungs can't properly hold the qi. Each needs a different herbal approach.
Celiac disease or sprue.
Often linked in TCM to a disharmony between the liver and spleen systems. Spleen qi vacuity is usually central, leading to poor digestion, and often there's an accumulation of damp heat, especially with the diarrhea and weight loss. It also mentions a specific pattern, queen and yin vacuity with internal brewing of damp heat.
Okay, cervical spondylosis, that wear and tear neck pain.
Yeah, degenerative changes in the neck vertebrae. From a TCM view, the manual introduces the wind-cold-damp impediment pattern, also known as Bi syndrome. This often involves pain, stiffness, maybe numbness that feels worse in cold, damp weather and better with warmth.
Cholecystitis, gallbladder inflammation.
Liver-spleen disharmony is often seen as a key underlying factor. The manual stresses using both acupuncture and herbs for acute attacks, and then specific stone-expelling herbs during remission periods.
Chronic active hepatitis.
A key complication TCM looks for is blood stasis obstructing the network vessels, especially if there's progression towards fibrosis or cirrhosis. Addressing that stasis becomes crucial.
Chronic fatigue syndrome, CFIDS.
Again, liver-spleen disharmony is often central, but it's usually really complex, involving a mix of other imbalances like Qi deficiency, blood deficiency, maybe damp heat, liver depression, all contributing to that profound fatigue and the wide array of other symptoms.
Okay, just a few more quick ones. Gout.
Often seen as damp heat pouring downward, affecting the joints, causing that red-hot, swollen pain. For more chronic gout with stiffness and nodules, it might be phlegm and stasis obstructing the network vessels.
Hashimoto's thyroiditis.
Patterns mentioned include liver depression with phlegm and blood stasis obstructing the network vessels, or maybe yin vacuity with liver-yang hyperactivity and phlegm nodulation. Often involves phlegm and stagnation.
Hemorrhoids.
Could be damp heat pouring downward, causing the acute swelling and pain, or if they're prolapsing or bleeding easily, it might be central qi falling downward, the spleen qi being too weak to hold things up.
Hypertension, high blood pressure.
The classic pattern is ascendant liver yang, hyperactivity yang energy rushing upwards uncontrolled. But other patterns like yin vacuity fueling that liver yang, or phlegm nodulation blocking flow, or even just qi and yin dual vacuity can also be involved.
And lastly, migraine headaches.
The main culprit in TCM is usually the liver system. Patterns often involve liver depression leading to qi stagnation, which then generates heat, fire, or even internal wind that rushes up to the head, causing that intense pain.
Wow. This has been such an illuminating journey, seriously.
Yeah.
So just to recap this deep dive, it's incredibly clear that TCM offers this really sophisticated, deeply personalized way of looking at health. Even with diseases we recognize in the West, TCM filters them through this lens of intricate individual patterns of imbalance. And the treatments follow that pattern, not just the disease name.
Exactly. It's truly holistic. It emphasizes how everything is connected, our symptoms, our energy levels, our emotions, the underlying state of our ki, blood, yin and yang.
It really is. Which I guess leads to a final thought for you, the listener.
Yeah, maybe something to mull over. Given how TCM works so meticulously to identify these underlying interconnected patterns, what might that suggest about the potential limitations of a health approach that focuses mainly on just managing isolated symptoms?
That's a great question, a really thought-provoking one. And if different Western diseases can show up with similar TCM patterns, well, it makes you wonder about deeper connections, doesn't it? Connections we might just be starting to understand.
Absolutely.
So for those of you whose curiosity was piqued by all this, we really encourage you, delve deeper. Look into some of the TCM concepts or specific conditions we touched on. Maybe research some of those herbal formulas or acupuncture points mentioned.
Definitely. Because ultimately, understanding different perspectives on health and healing just enriches our appreciation for how incredibly complex and amazing the human body really is.
Couldn't agree more. Thanks for taking this deep dive with us today.
Thanks, everyone.
We'll catch you next time.